Well, it can happen in an instant. A car accident, slip on a skateboard, slip on the ice, anything like that can lead to a traumatic brain injury.
The most severe cases can, of course, be fatal or leave patients with long-term deficits. Now Duke researchers say a simple hormone could be a huge benefit. WRAL's medical expert Dr. Alan Mask explains how the new treatment could help brain injury patients avoid the worst outcomes.
It was a late night out with friends last summer that 22-year-old Steve Jones will never forget, even if he does not remember much of what happened after that. He was in the back of a pickup truck as it rolled slowly to a stop.
Somehow I lost my balance and fell out of the truck, and that's how I got the brain injury.
And this dark area represents swelling.
Duke neurologist Dr. Daniel Laskowitz says Jones came into the emergency department with severe traumatic brain injury. Key to survival is minimizing the swelling and pressure on the brain.
There are treatments for traumatic brain injury, but we're limited in terms of what we can offer.
When Jones's mom, Ann Davis Jones, arrived at Duke the night of the accident, doctors asked her consent to include her son in a phase 3 trial involving an infusion of progesterone, a natural hormone.
And there's excellent data from early trials that progesterone reduces swelling, reduces some of this cellular injury in the brain.
I signed the consent, he got the shot. A miracle. I have my son.
The family does not know if Steve Jones got the hormone or just a placebo, but his mom is convinced he did. They want other families in the same situation to know about the trial.
I mean, it's good for everybody to know, you know, just in case something happens to them.
If the results bear out, it could become a standard of traumatic brain injury care.
So this is a phase 3 trial, meaning that if it works, there's at least a possibility that we'll have our first definitive treatment for traumatic brain injury.
Well, it's quite the story. You don't hear very often about studies done on traumatic brain injury, do you, Dr. Mask?
That's right, Jackie. You know, it's difficult to design a study for traumatic brain injury. You just never know when these cases are going to present to the emergency room. Of course, you need to have a staff of trial coordinators and hospital staff available 24/7. You also need to have a family member available to be able to sign the legal consent forms as well. This medication, again, a hormone called progesterone, ideally should be given within 8 hours of the injury as well. And certainly it's a reminder to us during this time of the snow and ice, we have to be careful with falls, be careful with accidents as well, because you just never know when these things can happen. But certainly this progesterone therapy is very promising.
Yes, it's very exciting. Dr. Mask, thanks for joining us on this Friday.